Good afternoon, everyone. I'm sure I see a lot of technology enthusiasts here in this healthcare world here in India, and that's the reason why we see a lot of signups from the doctors as well as the hospital administrators. We are very excited and we are very happy on the response. Thank you for all that, and a very warm welcome on behalf of Biro Solutions Private Limited. I'm sure you will all be excited as well to see what are the untapped capabilities that your clinics, hospitals can make in the digital world. Let me give you a brief overview about the origin of video consulting. The latest trend emerging in India among the internet surfer is the use of internet for online medical consultation. Though the telemedicine concept is pretty old one, right from 1850s, when the doctors used to carry a briefcase full of medicines all the way to patients' home to treat them. That's the scenario we could have imagined through many movies. I'm sure many of us would agree. So the telemedicine concept is not something new, and I'm sure some of the doctors hate the word telemedicine because medicine is medicine regardless of whichever way they do, right? So but the technology improvement has been very rapid, and every day with the internet growing at a rapid pace, it becomes very important right from the day. What can the healthcare do, right? So healthcare has to do its part, right? The patients are looking for it, and I'm sure the doctors as well as everyone in the healthcare spectrum are looking for it as well. So the WebMD concept, which started in 1996, was the first medical consulting website in the US. As you know, the concept became very popular with the term online doctor emerging in 2000. Soon a number of websites were launched dealing with online medical consultations: MSN Health, Everyday Health, Mayo Clinic, Women's Health. In India, the concept has started getting its pace too, and we observed a drastic increase in the demand of online consultation. So how could you all benefit out of it? The first benefit is your time. Your time is precious, as important as anyone's, right? So the advantage here is practicing it anytime and anywhere as per your convenience. You also get an offer of servicing large number of patients, and regardless of the geography, and that adds flexibility and a higher level of service. The constraint which led to tied to a single facility or a hospital easily gets eliminated, and management of the patient's health records, case history, everything becomes automatic, right? You get access to it right on your phone, on your tablet, on your laptop, on your desktop, at your fingertips, which is very, very important for a doctor. And obviously it reduces the overhead for the administrators too, as the cost comes down rapidly. It doesn't require a special front office desk, receptionist, and a bunch of specialists like an IT people. You don't need them. You want everything at your fingertips, and that adds up the benefits, right? The patients gets immediate access to physician on an approved time slot. The time slot is approved by the physician in themselves, and it's both secure and private, and the patient have a choice of going to the best one, the best doctor. The patient can subscribe to a doctor, a specialist doctor, which is not available in his village, town, city sometimes, and they can get the best of the best facility with the help of the doctor's time. And the major advantage patient gets is receiving care at his convenience, right? And it reduces the cost and time majorly, right? Also, the patient can get sometimes 24 by 7 round the clock access to the on shift doctors, which is very important when it comes to some kind of specialities wherein they want to know whether it's an emergency or something, right? So I would like to state one of the article from one of the leading publication. It states that the general practitioner and residentials aged care facility, with the aim of enabling faster access to medical care and avoidance of unnecessary hospital transfers, were paid for video consultation at a rate to equivalent of existing insurance reimbursements for supporting the telehealth services. So what does that mean? These data were gathered by direct observation, right? 40 video consultations were found to be eligible for payment occurred over a 6 months period, which totally avoided the hospital attendance. This is substantial. So what it says is, when a doctor enables video consultation, the routine becomes embedded. The patient is still taken care, and it avoids every churn that occurs on the process cycle, right? And the doctor provides the external care in the form of virtual world, which is still good, right? So that's what it means. Its role in communication in healthcare is one among the uniqueness. The rapid digitization of medical information is transforming healthcare delivery. Care providers increasingly require better communication and workflow tools to speed up tasks like HIS updates and care team coordination. You are able to share patient health information needed for informed care decision as quick as possible, right? You can greatly improve care quality and patient safety. Your communications are kept safe, thus improving the overall workflow. Data digitization is widespread across the globe, and its application is much compelling as the concept of video consultations. This is not new one too. Probably almost all the hospital has their own form of a customized one. Utilizing electronic health records with the hospital is a way for hospital doctors to be researchers and to interact and collaborate together. There is a place for you in the midst of all this as a facilitator and manager of data service. In theory, the potential for electronic health records is limitless. Mining patient health data could improve many aspects of healthcare delivery, including patient safety, quality of care, and evidence-based practice. However, we'll take another webinar to discuss that in detail. Coming to the data management perspective with respect to video consultation. When you're looking for a video consultation provider, please look for a firm which does encrypted data handling. This is absolutely for compliance purpose. NABH, HIPAA, all these bodies require this. NABH becomes a mandatory thing in few years from now. We don't need to be caught pants down when that occurs. And ensure the provider makes it totally digital so that you stop wasting your precious resource, right? Time, as well as right now ink and paper too. Everyone wants to be on the sustainability mode, right? And you don't need to wait for a fax machine for a simple result, right? It has to be digitized. When they are able to digitize in such a level, that's the provider you had to better. And these addresses quite a few issues, which leads to a messy healthcare service that we see currently. You can see patients complaining about busy phones, long waiting line, helpless staff, feeling more sick when they are in the hospital. And the doctor, they have a huge number of walk-in patients. There are some late arrivals. It's all crowded and chaotic. And they see that each case is unique. And the clinical staffs, they have their own issue. They see the patients are more demanding, and there is absolutely lack of info. And many are sick and tired, and many would like to leave their job. The attrition is a problem in itself. So, on an overall, this is an overlooked problem which affects everyone, right? Now let's see how the mobile and internet is changing the healthcare communication in India. As you know, telecommunication throughout the world has been growing, but India has been leading the revolution. Now, 77% of the Indian population has mobile. The penetration is really great. It's much rapid than any other country could have done. Experts estimate that there will be 651 million smartphones in next 4 years, which is more than half of our population. 44% of smartphone users prefer messaging and apps for all the communication. There is an app for everything. That's a mantra. And 49% of this population search for health and fitness info. And survey shows that 99% of the respondents are willing to make an appointment with doctor via their phones. Smartphones or phones. They're ready to make it. And there are 213 million internet users as of end of last year. This is doubling every year. That's what the survey says. So the internet growth is really growing, and this is the area that healthcare has to offer its services. As a doctor as well as an hospital admin, we know that timely utilization of the needed services is the need of the hour, and you would absolutely want to decrease your administrative cost, and obviously you would like to have a technology which secures all your info and still comply with NABH as well as the HIPAA. And every communication has to be built on a confidence level, and the patient has to feel an experience in itself, right? And I'm sure many of you would have already invested in software like the HAS, EHR, medical record in a simpler or a complex way, and you would like a solution which does all this, which provides all this and gives you the control that you need. So let's look at who are the video consulting providers in India. Byro, eVaidya, iClinic, MedIndia are some of the few. So if you look at this list, who satisfies all of your requirements? Byro stands up front. There are some other providers who are closer, but still no one can guarantee the technology risk that comes with an audit. Byro is able to provide you that guarantee in the form of business agreement, which is very important when you look at the NABH as well as the HIPAA technology risk that comes with it. And who does the integration? This is very, very important. You have an existing product, HIS product, and I'm sure you would like to have it integrated with your HIS to avoid double data entry and to introduce new risk. That's where Byro comes in. They make it very easy to do the integration and still provide you the excellent platform that you need to talk to your patients. Now let's look at what are the advantages for Byro. It absolutely works for all patients. There is no limit, and the doctors feel much more ease, not wasting their time with a product which just takes 60 seconds to learn anything on it. And it greatly improves the staff efficiency. And the models are all principle based models. And it has an integrated payment gateway which makes it easier for your patients to self-register as well as make an appointment based on the slot you had provided on a day-to-day basis or on a weekly basis or a monthly basis. It's totally integrated to your calendar, and they can upload their existing case files, you can upload your case notes, and there are many features which makes it easier for this platform to work in a secure way. So here are some of the screenshots wherein you can see how the feature works. And here is the payment gateway that we are talking about, wherein it's super fast, totally secure, and puts your billing at ease with respect to your patients. With this, I would like to open up for Q&A. We'll be getting the questions in the form of text chat, and I would like to answer as much as I can. Okay, the first question is from Bangalore. They would like to know the commercial aspect of Byro. Yes, we cater to all sort of clients, right from individual doctors, clinics, to small, medium and bigger hospitals. We do offer enterprise telemedicine, which makes it easier to set our price. Our price is very cheaper when you compare to the value it generates, and we would be happy to give a custom prime quote if you are able to let us know your interest. I would give our contact details here subsequently shortly, and we'll be able to arrange a demo and make sure you're comfortable before we take you into the investment mode. Thank you. The second question is from Chennai. They would like to know how our integration works. That's a very good question technically. So there are two levels of integration: online integration as well as offline integration, and there are 15 data models we rely on to do the HIS integration. If you look at the number of HIS in the world, there are thousands of HIS in the world right now, and in India it's in hundreds. With the simple client server technology to the modern cloud based technology, there are a number of HIS which does this, but we have our own engine developed just for this integration, just to make it easier for our client base. So the offline integration and online integration can be done to do the HIS totally integrated with our product, so that it makes it easier to serve your existing patients. For more information and for a free demo, please reach us and we'll be able to answer it. Thank you. Once again, thanks everyone for making it today. Our contact details are here. Our email address is sales@byrocorp.com. and we can be